In Europe and the USA alone, every year 15 to 20 million patients present to the emergency room with symptoms suggestive of acute myocardial infarction. Some of these patients are at high risk of long-term mortality. It is crucial to identify these patients as early as possible to ensure rapid medical investigation and adequate life-saving intervention. Together with ECG and clinical signs and symptoms, with the Roche Cardiac Point-of-Care Troponin T Test on the Cobas H232 system, those high-risk patients can be identified in just 12 minutes. If the troponin T value is 50 nanograms per liter or higher, immediate action should be taken. With the handheld and easy-to-use Cobas H232, the point-of-care troponin T test can be applied in mobile situations, which allows earlier triaging of patients with suspected acute myocardial infarction in pre-hospital care and in the emergency room. Let us look at a patient with chest pain in different scenarios. In a general practitioner's office, applying the point-of-care troponin T test helps to make confident decisions on where to send the patient next to the cath lab hospital or the local hospital. If the point-of-care troponin T value is equal or higher than 50, the GP can send the patient directly to the nearest cath lab hospital. In the next scenario, a patient with chest pain calls emergency and is being picked up by an ambulance. Using point-of-care troponin T testing in the ambulance, patients at high risk of mortality can directly be delivered to a cath lab hospital, avoiding costly additional transports. In the next scenario, a patient with chest pain presents to a cath lab hospital. In the emergency room, the patient can be identified in 12 minutes and be triaged straight to the coronary intensive care unit or cath lab. Scenario 4. A patient presenting with chest pain to a local hospital can quick and easily be triaged correctly by performing the point-of-care troponin T test to a cath lab hospital. The point-of-care troponin T test is intended as an early aid in diagnosis of acute myocardial infarction and identification of patients with an elevated mortality risk. When used in pre-hospital care and the emergency room, it allows faster triage of high-risk individuals, ensures quick and adequate treatment at the right location, and contributes to saving time and costs.